Hi, Chris. How you doing today?
Hi, how are you?
I'm good. My name's Kim, and I'll be here today talking with you about Maya.
Mm-hmm.
That's okay.
That's fine.
Okay. Do you go by Chris?
I go by Chris.
Okay.
Yeah.
And are you familiar with what a nurse practitioner is?
Yeah.
Okay.
Familiar with it.
Okay. So I'm a nurse practitioner student with the University of Illinois at Chicago. And so yeah, I'm glad you're familiar with it. We basically can do a lot of the same roles and responsibilities as physicians do in your practice. And so today I'm gonna gather a full health assessment on Maya. So thank you again for volunteering.
You're welcome.
I already gathered all her name, birthday, date of birth, so I won't go over that again with you. But so today, what brings you in today for Maya? Just
a checkup.
Okay, all right. Overall, how would you say her health is?
Pretty healthy for her age.
Okay.
Just minor stuff here and there. You gotta get checked up. That kids her age would need checked up on.
Okay, and then for how old is she? Just for the reporting.
She's 6.
Okay. 6. All right. So what was the reason for her last examination?
Not really. I mean, her mother would have all that. I don't have the files on me right now. If I need to I can provide those to you if you needed them.
Okay. I mean, just like in general, like the last time you think she went to the doctor, what was she probably sick with or for that you can remember?
I mean, what I remember beginning of the school year, she
Okay.
did a physical.
Okay. Perfect. Beginning of school year physical. Okay. And then who do you primarily see when she needs things like physicals and whatnot? Do you go to the same physician or?
Yeah, it's her pediatrician.
Okay, great.
Family one we would have.
Okay. Does she have any type of significant or chronic illnesses? Anything that's managed regularly with the doctor?
No, it's just her normal checkups,
Okay.
but nothing chronic that we have to manage.
Okay. So no like asthma or any stomach issues or anything like that, or just offhand?
No.
Okay, great. Do you have any concerns today with her health or well-being or anything going wrong with her you think of?
No, nothing major.
Okay. All right. Do you have does mom typically take her to the pediatrician? Or do you both?
She schedules a lot of the appointments, and then so I'll take her as needed.
Okay.
Usually I don't get out of work in time to be able to take her. So
Okay.
She's more flexible to do that.
Okay. Do you happen to know the dates of like if she's all up to date with her immunizations or anything? Do you happen to have any of that information?
To my knowledge, she is, since she's in school.
Okay.
So they usually don't let him in the school without up to date on those.
Okay. Do you know if she's had any recent exposure or anybody that you come in contact with tuberculosis or hepatitis or any types of communicable diseases, Ebola?
Not to my knowledge.
Okay.
She doesn't seem like she would be showing any of those signs either.
Okay, good. So I could get just some further dates for immunizations.
Yeah, we have all that.
Okay.
We just have to get with the doctor and my wife.
Perfect. Does she have any allergies to anything you can think of? Does she have seasonal allergies or anything environmentally, like mold or cats or dogs you can think of?
No allergies that we've noticed.
Okay. Any food allergies you can think of offhand?
No allergies.
Okay. And then do you know of any medicines that she's allergic to in the past, like penicillins? Anything she's ever taken that's caused any type of...
No, she's only taken the standard stuff, and she never really has been allergic to that.
Okay. And then she's not allergic to latex that you know of, right?
No.
Okay. Great. Has she ever had any past hospitalizations for any reasons?
No hospitalizations.
Okay, so no surgery, any types of procedures of any kind, tonsillectomy or Anything like, does she have tubes in her ears or anything like that even?
No.
No? Okay.
Nothing major like that.
Okay. Has she ever been to the emergency room for any types of visits or after anything, any accidents?
No, she hasn't had any major. She's still young, so hasn't really gotten into sports yet. So
Okay, great.
nothing yet.
Good. Has she ever had any types of like major accidents or accidentally ingested anything or like drank any substances she shouldn't have in her house or?
No, we keep all that pretty high covered away, so
Okay, great.
she's never got into any of that stuff.
Okay. Has she ever? She's never broken any bones or anything, fallen off a bike or.
No broken bones. Just being a kid, she falls and gets bumps, bruises here and there. But
Okay.
we look at her and check her out. She never really had. She doesn't have any major issues or broken bones yet.
Right. Knock on wood.
But she's active, so
good.
Anything could happen.
Right. Does she take any medications regularly, prescribed by your pediatrician or anybody?
No medications regularly. Only when she feels kind of sick or something.
Okay.
Just the normal.
And what would you give, like for if she like had a fever or cough or something?
Just if there was like any prescribed like cough syrup or like I don't know, Tylenol or something.
Okay. Does she take a vitamin or anything like that every day?
Yeah, she just takes like the basic Flintstone vitamin stuff that we give her.
Perfect.
Stuff that tastes good. She enjoys.
Perfect. Awesome. Do you guys use any other types of alternative therapies or acupuncture, chiropractic for her treatments?
No.
No. And do you have any types of special diets or any religious diets that you?
No, we just try to watch. Just eating healthy and trying to get the nutrients she needs. Like a well balanced meal, so nothing like a special diet. But
Okay.
Just eating healthy.
Great. Thank you. Okay, so I'm gonna just ask some general questions about your family and about from your side and mom's side. So just to the best of your knowledge. So for are both of your parents still living?
Yes, both my parents.
Okay, so father. And how about, do you have any siblings?
I have one brother. He's younger.
Okay, younger. How old is he?
He's 23.
23? Okay, and how old is your mom?
She is 52.
52. And your dad?
He's 54.
Okay. And in general, are they all in good health?
Yeah, I'd say so. I don't know any major issues that they're suffering from.
Okay. Well, I'll get into some specific things and ask in a minute. I just want to get the big picture of who's all on each side.
They still work their job.
Okay.
And still able to
both work. Okay.
do that.
Great. And then, so for Maya's mother, are both her parents still alive?
Yes.
Okay. And then, how old's her mother?
I'd say around 50.
Okay. And father?
53.
Okay. And then does she have siblings?
She has one.
Okay. One sibling. And then how old would you say about they are?
27.
27. And how old is mom? Maya's mom.
Oh, sorry. 29.
29. Alrighty. Okay, so just in general, do any of these, between your parents and your wife's parents and then siblings, do they have any following that you know of? Any allergies you know of offhand?
The other family members?
Yeah, just between all of, or for yourself, or mom. Do you know of any, like, allergies or any types of,
I know my mom, she has, like, the seasonal allergies,
okay.
like pollen and stuff.
Okay.
Her family, I'm not really sure. I'd have to
Okay.
ask her if I could get that information for you.
That's
but
okay.
I'm not sure what their allergies are.
Right. No, that's okay. How about any asthma that you know of?
Um, her sister, I believe, has asthma.
Okay. Perfect. Anybody have high blood pressure or heart disease or stroke? You've known
No, nobody in my family.
of? Okay. Diabetes, cancers, thyroid diseases, anything like that?
My brother, he had leukemia when he was growing up.
Okay. And he obviously survived.
Yeah.
And conquered that. Great. Great. Okay. So leukemia. Any, and then on mom's side that you know of, mom or parents?
On her side, no, no illnesses.
Okay. Any thyroid diseases or maybe blood disorders that you know of?
No.
No. Okay.
Nothing on their side.
How about obesity? Is anybody morbidly obese or have any types of issues with that?
No, everybody's pretty
Good.
healthy weight range.
Good. How about vision or hearing? Does anybody have like wear hearing aids or anything like that, or have any serious vision problems besides glasses, maybe?
Well, my mom has. She wears contacts.
Okay.
Uses glasses.
Okay. Okay. How about do you wear contacts or glasses too?
I have a LASIK.
Okay.
So I did wear contacts and
Okay.
glasses when I was younger.
Okay. Perfect. Does anybody have any neurological problems that you know of, or any seizure disorders or emotional problems, mental handicaps? No. Okay. Anybody have any substance or alcohol abuse history that you know of?
No.
Okay, great. Thank you. Are you concerned about any of your family's history, medical history, in terms of your child?
No, not to this point.
Okay, great. So, who all lives at home with you? Or with Maya, I should say.
It's just me, her mother,
Okay.
and Maya.
All right. And what do you do for a living?
I'm a teacher.
Okay, awesome. What do you teach?
Special education.
Okay. Great. And then, Mom, what does she teach? Or I'm sorry. What is your wife do? What's Maya's mom?
Oh, she is a secretary.
Okay. Wonderful. And then, how? Okay. So, and then, what grade is Maya in school?
She's in kindergarten.
All right. Awesome. And does she go to public school or private school?
She goes to public school.
Okay. Does she have any special interests at all in school specifically?
Like as far as subjects?
Just in general. Mm-hmm.
She really likes to when they do like reading, independent reading. She likes to do.
All right.
Or read aloud for everybody.
Okay.
She enjoys PE, being active and stuff. So we're gonna start getting her in sports.
Great.
Soon.
Yeah, that's awesome.
Just normal girl stuff.
Okay. How does she behave overall in school? Does she have any problems with behavior?
It's still kind of early in the year, so she's getting a little used to the structure of school. So she has some acting out, but I think it's more just getting used to school.
Okay. How do you handle problems with Maya?
We talk about it with her and have her, talk about what would be the right thing to do and let her know that it's a choice she's making. So,
great.
And then just try to set incentives in place.
Okay. And incentives, great. And then does she handle other authority figures well, or is she generally, does she well respect authority figures, or is she kind of more?
Yeah, she'll listen.
Okay.
To it once she gets to know them a lot better, then it's easier to. She takes like direction from those people too.
Okay.
So I think she'll do fine as the year moves on.
Great. Does Maya still wet the bed at all?
Every now and then, like maybe I don't know, once a week or something.
Okay.
Too. And it might just be because she gets too much to drink before it doesn't go to the bathroom.
Okay.
So
that's normal.
Yeah.
How about does she suck her thumb still?
Not that I've really noticed. No.
Okay. Does she bite her nails?
No.
Oh, that's good. That's a hard one to break.
Mm-hmm.
Does she throw temper tantrums? Or is she pretty mildly mannered?
She'll throw temper tantrums mostly when she doesn't get her way.
Okay.
So we're working on that.
Okay.
But it's not a lot. It's just
okay. What kind
here or there?
What kind of discipline do you guys are you? How do you use discipline in terms of punishment with her when she acts out?
Make sure she knows there's a consequence to everything she does. So let her give the opportunity to try to fix what she did by giving her a warning, and then if that doesn't work, then you move down like some timeout or maybe a loss of a privilege.
Okay.
I think it's too extensive or too bad.
Mm-hmm. Okay. How do you think she sleeps overall? Sorry. Does she generally sleep through the night?
Yeah, she sleeps through the night.
Good. Does she what times would you say she typically goes to sleep and wakes up around?
We try to get her to bed or at least start the routine about 8 o'clock at night.
Okay.
And then try to get her up around 6 o'clock.
Okay.
So try to get her moving, get her a good breakfast and ready.
Okay. And then does she nap in the day?
Well, not at school because
okay.
they don't do that anymore. But then, on the weekend we'll lay her down because usually if we're out busy doing stuff, we'll take a little rest before.
Okay.
During the day.
Okay. Does she have nightmares frequently or?
No, not frequently.
Okay. How often would you think maybe she would have a nightmare?
If she sees something.
Okay.
Like scary or something, but it would probably trigger. But that would be about the only time that we notice.
Okay. In terms of like recreation and things like that, how much screen time do you think she how much screen time is she allowed, per day, would you say, or do you have like a routine with an amount that she's allowed?
Yeah, we only, now the weather's nice too, we try to get her, maybe like at home, hour, 2 hours between like either TV or if she wants an iPad or something.
Okay.
So no more than 2 hours. And then like the iPad might even be, she's reading, so she's doing something academic on the iPad.
Okay.
So it's, try to get no more than 2 hours.
Okay. And then does she play any like handheld games or anything?
Yeah, but she really doesn't do that during the weekdays because we get really busy. It's more of like a reward. With having to do homework and everything.
Okay.
Family time.
Okay. Does she participate in any recreational activities like outside of school or sports or anything like that? I know you mentioned it earlier. That you're
just playing at the park now. We really haven't got her into a lot of out like stuff in the community yet, but we're looking into it now.
Okay.
She'll be doing stuff coming up.
Cool.
Recreational stuff.
Awesome. All right. In terms of like eating wise, what would you say? What would like the normal, like the last 24 hours? What would her intake look like? Like in terms of what do you think? Like for breakfast, what would she normally eat?
You get her a glass of juice, bowl of cereal. That's about breakfast.
Okay.
And
then she have like a snack at school.
I don't know if they do snacks. I think they go right up to lunch.
Okay.
But I think they might get snacks like during their activities and stuff. I'm not sure. It'd be something healthy though.
Okay.
The schools require that.
Okay.
Lunch, we usually pack her lunch. So it'll be something like a fruit, sandwich, vegetable.
Okay.
Maybe like a treat here and there, like something, like a piece of candy or something.
And then for dinner, do you typically eat at the house or do you eat out a lot?
We'll eat at the house probably 5 out of the 7 days.
Okay.
Usually, some of the days if it's busy, we'll eat one of the days, and then one of the other days is like just to go out and family time outside of the house.
And then does she drink? Is she allowed to drink soda or pop or pop or
soda only on special occasions?
Okay. And then for dinner, what would be like a normal dinner meal look like? Like for yesterday, what did you guys have for dinner?
We had like grilled chicken, maybe like a vegetable on the side, and then some rice to go with it.
Great. And then does she drink milk and as well with her meals usually, or?
Yeah, we encourage her to drink milk, like at dinner. She'll get it she'll eat it with her cereal in the morning.
Mm-hmm.
So yeah.
Okay.
And at lunch she'll go to milk too.
Okay, great. And then, so with coping and stress management, does Maya have any, or do you guys have any concerns of bullying, or does she have any anxiety, things like that? About school?
No, it's her first year of school, so she's a little kind of anxious, but it's been in the first month of school, so.
Okay.
But no other concerns.
Okay. Has Maya ever been exposed to any types of violence or abuse? Would you that you know of?
No.
Okay. She's never had any type of unwanted sexual contact or anything like that in her past. I know it's a really awkward question to ask. Okay. Okay. So in terms of her developmental status, do you have any concerns with her development and growth, or do teachers have any concerns with if she's on par with her, speech and reading level?
Yeah, early in the year we haven't noticed any issues yet. We're still waiting to hear back, on when the progress reports and everything come out. So.
Okay. But up until now, your pediatrician hasn't had any concerns with her?
Developmentally, she's on par.
Okay. Do you guys, for safety, do you guys wear seatbelts, or is she in a booster seat?
Yeah, she's in a booster seat though.
Okay.
We all wear seatbelts.
Okay. And then do you guys wear helmets when you ride bicycles?
Yeah, yes we do.
Okay. And then do you have smoke alarms and carbon monoxide alarms at home?
Mm-hmm.
Great. Does anybody smoke in your house?
Nobody smokes.
Nobody smokes. Okay. Any pollution that you know that you're exposed to in the community or in your house, or any concerns with generally like the environment?
No.
No? Okay. Is your water clean and good to drink? Are you allowed to drink faucet water?
Yeah, it's from the city though.
Okay.
So it's filtered.
Good. Do you guys have any specific religious affiliations?
No.
Okay. Okay, so I'm just going to ask some general questions about Maya's overall, health and well-being. If you've noticed any of the following. If she's had any, fever lately, or chills, or if she's tired, or anything like that.
No, not that I've observed.
Okay. Does she have, night sweats at all when she sleeps that you notice?
No.
No. Do you know her current weight offhand? Approximately?
She's 40 pounds.
40? Okay. And has she been progressing pretty steadily, or since she's been a baby?
Yeah.
Okay. All right. Does she suffer from any kind of chronic pain or anything? Does she talk about being in pain ever?
No.
No? Okay. But how do you guys assess for pain from her? Does she tell you if she's, not feeling well, or?
Yeah, she'll come up and tell us.
Okay. Have you noticed any changes in her skin or color?
No.
No? Any moles? Anything like that?
No, nothing that we've noticed.
Okay. Anything different with her nails that you've noticed? Looking any different or anything?
No.
No? Okay. And do you guys use sunscreen?
Yes.
Okay.
Yep.
Anything, have you noticed any differences in her hair? Is it shorter on the top at all? Does she pull it out at all?
No, that's what I've noticed.
Okay. Does she wear eyeglasses?
No, not currently.
Okay. Has she had an eye exam yet?
I think she will get one this year at school.
Okay.
So they bring people in to do that. So.
Does she have a wandering eye or a lazy eye or any eye infections?
No.
No. Okay. Has she had a history of ear infections?
No.
No. Not even as a baby.
I can't even remember.
Okay.
It wasn't. If she did, it wasn't a lot of them.
Okay. Great. That's nice. A lot of kids have a lot of them.
Yeah.
And so none in the past, year, you'd say even.
No.
Okay. Great. Does she get like a runny nose at all a lot, or have like sinus infections, or?
She got a runny nose, but not like due to. I don't think it's due to sinus infection. Just like a cold here and there.
Okay. Does she brush her teeth every day?
Yes.
Okay. Does she floss?
Yes.
And then do you know approximately the last time she had a dentist appointment?
It was earlier this summer. I can't remember the date.
Okay.
It's around June though.
Does she have any missing teeth?
No.
No. Has she lost a lot of teeth yet?
I'd say a lot of her baby teeth have started to go away.
Okay. Would you say approximately how many do you think she's lost?
Baby teeth?
Mm-hmm.
I can't remember. I'm not there for all of them. So.
It's okay. Do you notice any like swelling or stiffness in her neck or any lumps or anything like that?
No, not that I've noticed.
Okay. Anything in her like chest? Any discharge from her her breasts or anything like that?
No.
No. Okay. Does she have a cough or any like spit up with a cough or anything like any phlegm?
No.
Currently, does she get like short of breath or wheezy?
Like after running or after?
Just in general, if she has any like wheeziness going on right now or.
No.
No. Okay. And you said no history of asthma?
No.
Okay, great. Is there any, I know you said there's no like major medical history, but she doesn't have any congenital heart diseases that you know of?
No.
No. And then does she have any like, does she get really tired with eating?
No.
No? Okay. Any heart murmurs that you know of?
No.
Okay. Does she get diarrhea or have a problem pooping?
No, just, if she eats something that might upset her stomach, she'll get it, but nothing out of the ordinary.
Okay. Does she poop every day, would you say?
Yeah.
Problem it. Okay. Great. Any nausea or vomiting recently?
No.
Okay. Any, she told you about any tummy aches or stomach aches or anything like that? Abdominal pains?
No abdominal pain. She gets like I said, if she eats something that might upset her stomach, she'll get a tummy ache, and she'll tell us.
Okay. Does she have a? You talked about she wets the bed, on occasion. Does she wet her clothes ever anymore, or does she wear pull-ups sometimes?
Yeah, we still have her wear pull-up.
Okay. And is this all day or just at night?
Just at night.
Okay. Does she ever complain about her urine hurting her when she's peeing?
No.
Okay. Does she have any like? Does she walk funny or like have any differences in the way she's walking lately or any stiffness that you noticed?
No, same as usual.
Okay. Has she ever had any head injuries or loss of consciousness?
No.
Mm-hmm. Does she get dizzy easily or fall down a lot?
No.
Mm-hmm. Okay. Does she complain about any like numbness or tingling or any sensations like that? in her hands or feet or anywhere?
No.
No. Does she get headaches?
No, just if I think every now and then she'll get some, but it's very. I don't like. I don't know. It's like something loud or something. It might give her a headache.
Does she have any cognitive impairments that you know of yet?
No.
Okay. Is she irritable or have mood swings?
No.
Does she have any history of blood transfusions, or does she have any sensitivity to like heat or cold environments, hot or too cold?
I don't know. If it's too cold, she'll let us know.
Okay.
So.
No. Does she bleed really easily or bruise really easily, or just would you say normally?
Yeah, normal.
Okay. Generally, would you say she's a happy kid?
Yeah.
Yeah. Okay. Predominantly happy. She's not angry or.
No. She's really happy. I'll say.
Okay. Do you think does she have any hallucinations? Does she have any imaginary friends that you know of?
No.
Okay. And does she eat pretty well, or would you say she has any like I wouldn't call it eating disorder maybe at this point, but does she have any problems with eating, or does she typically eat pretty well for you guys?
Yeah, she'll eat it's the vegetables that'll be hard for her to eat, but
she doesn't have a poor body image in terms of how she eats.
No, I think it's just
she doesn't like
food.
veggies. Okay.
Like she'll eat food in place of it. So.
Great. Is there anything else about her health that you're concerned about at this point in time?
No, I think this time.
Awesome. Well, thank you very much for your time, and I appreciate it.
You are welcome.